So what is aging? This is a definition, a state of existence that is arrived at slowly, may be defined as a series of disadvantaging events that normally occur in our bodies over time. And unfortunately, I'm going to go into quite a bit of those disadvantaging events just to outline them for you if you haven't already experienced some of them yourself. But of course, Wikipedia is our current standard of how we get definitions. So I knew that if I didn't share it with you, that you would go home and Google it yourself. So this is the Wikipedia definition of aging, which, gee, I think is a little complicated. I won't even try to read it. I'll let you look at it. I don't understand why they actually modified it to include this issue about deterioration. But in any event, this is a process that we are all living through. Let's just turn to our organs and our systems one by one and see what the effect of aging is. With regards to skin, our dermal layer grows thinner and the collagen fibers degrade, causing loss of elasticity of the skin. 50% of us have gray hair by the age of 50, and most men over 60 are partially bald. Tooth enamel more prone to cracks. Your gums recede and old fillings disintegrate, and these oral problems in the elderly often lead to poor nutrition. With regards to eyes and ears, our lenses become less elastic after 40. Muscles controlling the lens weaken, causing our inability to focus on nearby objects, so i.e. reading glasses. Cataracts are common after age of 60. Walls of the ear canal become thinner and drier, while nerves and sensory cells die. Hearing declines 25% between the ages of 60 and 80, and nearly 1 in 3 over the age of 65 have hearing problems. Bones and muscles, both men and women. We generally credit women with having the osteoporotic bones, but it happens to men as well after age 50, as well as deterioration of joint cartilage. Muscles lose size and weight in relation to the rest of the body, and with the decrease in the muscle mass, the body burns fewer calories because muscles are generally the furnace where we burn a lot of calories. So this increases our tendency to gain fat. Fatty deposits in scar tissue slowly accumulate in the lining of the blood vessels, reducing blood flow to vital organs, as we all know, the heart, the brain, the kidneys. Blood pressure often increases. At age 55, the proteins in the lung become less elastic. Coupled with the gradual stiffening of the chest wall, the lung's ability then to transport oxygen also decreases. Gastrointestinal and genitourinary tract. Gastric juices and enzymes decrease by 60. Food moves more slowly through the colon. Some nutrients are less readily absorbed. Kidneys become less efficient. Bladder muscles weaken. 1/3 of seniors experience urinary incontinence, and enlargement of the prostate causes many problems in aging men. I know this litany of all this deterioration, I'm giving it to you up front so that we can move on to some happy news afterwards. Reproductive hormones decline after 50 with that very sharp, well-known menopause for women, and a more gradual decline in men that some are trying to call andropause, just to give that sort of a syndrome. These effects with the decline of these hormones range from mood changes to loss of bone and muscle strength. Menopause also causes changes in the vagina that may lead to painful intercourse, precipitating a loss of interest. With regards to aging in the men, impotence itself is not actually a symptom of male aging. However, erections become less rigid and ejaculation less forceful. And as a Harvard study showed, so it must be true, the men in the room will cross their legs here. With regards to the brain and nerves, the brain reportedly shrinks by 10% between the ages of 30 and 90. The frontal lobes shrink 30% after age 50, and the hippocampus, responsible for memory, decreases 20%. Neurons, the nerves in the brain, become less dense. So processing ability wanes, but attention and language should not suffer just by aging itself. Somebody said, you may have the same size hard drive, but the processing speed is slowing down. That's how we would define the cognitive effects of aging. there are certain risk factors for cognitive decline, or i.e. becoming demented. The ApoE4 gene increases the risk of Alzheimer's disease. Some comorbid conditions, such as high blood pressure, diabetes, or heart disease, also increase the risk for cognitive decline. Exposure to lead, smoking, alcohol, or use of other substances, lower educational level, interestingly, lack of physical activity, lack of social interaction, and high stress levels. And we're going to go into all of these different issues in more detail and talk about how best to avoid cognitive decline. But you're all doing it here by staying intellectually engaged, remaining physically active, being socially active, practicing stress reduction, avoiding tobacco, certainly, and alcohol in moderation, treating the diseases that may lead to decline in cognitive function, high blood pressure, diabetes, depression, and elevated cholesterol, and again, if you need them, using hearing aids and glasses. So what about aging? Why does it happen? What causes the body to go through all of these different changes that we're all so happy to wake up each morning to experience? Well, one, of course, free radicals are always blamed for everything. Oxygen, you know, likes to live paired, O2. When you have a single oxygen, that electron does damage to DNA. And so many people thought aging is a process of free radical damage and oxidation. Or is it genetic mutations of DNA accumulate over time just through cells dividing and dividing? An interesting theory, the rate of living theory, which I believe has been disproven, is that your duration of life is inversely proportional to the amount of energy that you expend. So hyperactive people tend to live shorter lives, so that's not necessarily true. The error catastrophe theory is synthesis of proteins sets off a cascade that damages cells and causes cell death. And then a cross-linkage theory, which is popular among people who promote chelation therapy, suggests that there's progressive cross-linking among structural proteins of the cells, which causes organ decline and death. Now, you know, I like to be evidence-based as much as possible, but I told you I am not a gerontologist, so I don't have real expertise in aging beyond my own experience and my learning about how to prevent cancer and cancer recurrence. But I did find, actually cleaning my house recently, a July 2001 Newsweek. The results were published in a special fall-winter 2001 edition of Newsweek called Living Longer, Living Better. In this poll of really a small number of 801 Americans aged 45 to 65, 3/4 thought that they would live to be 80, and 11% thought that they would make it to 100. Half rated their current health as excellent or very good, and the other half were somewhat below that. Now, in looking at death rates at different ages, in North America and Europe, the annual death rates among 15-year-olds are very low, 5 per 1,000. Among 50-year-olds, it's increased 300-fold, so that the death rate is 1.5 per 100. Among people who are 105 years old, the annual death rate is 50%. So 1 out of 2 of those are not going to make it. The increase is mainly due to mortality from heart disease, cancer, and stroke. Eradicating these 3 problems would only add 15 years of life, which is half of the gain that we achieved in the 20th century, when the lifespan lengthened 30 years. It's a very dramatic improvement in the lifespan in the 20th century alone. Because people that are 80, even if they don't get cancer, will soon die of something else. So what are the goals of healthy aging? Christian Bernard, the one who invented the heart transplant, said, die young as late as possible. Andrew Weil, who's sort of one of my gurus, said that the goal of healthy aging should be compressed morbidity. And if you think about it, it means live a healthy, active life for as long as you can, and then at the end, before the end, have everything compressed. Your morbidity, which is, you know, not doing well, should not be strung out over a long period of time, but compressed. So let me just disclose that with all of my career over the past 25 years. In 2002, I became a fellow in the program in integrative medicine at the University of Arizona, which is Andrew Weil's program. And I did an online distance learning fellowship in integrative medicine, and that's how I learned much of what I'm talking about tonight. And I became friends with Andrew, and I really loved his book, Healthy Aging. I don't know if people have read it, but it is in the bibliography that I've given you. And what I'm going to do now is really much of the remainder of this discussion is going to be looking at the 12 points. Everything's always 12. I don't know, why they're... Anyway, 10 isn't good enough. I don't know. But Andy gives a 12-point program for healthy aging. And fortunately, the number one is really my number one, too. And again, taking this back to cancer, I think everybody appreciates that 30% of malignancies around the world are related to tobacco. But what people don't know is that 30 to 40% are related to what we eat and what we don't eat. And in our body, we have a lot of ongoing inflammation. What is inflammation? If you get a cut or surgery, then when you're healing, you get heat and warmth and redness, and that ultimately leads to healing. But that process is inflammation. We have that ongoing in our body because of damage through free radicals, through buildup of cholesterol, and that inflammation is not leading to healthy repair of tissues, but actually to damage of tissues. And so Andy's advice is to eat an anti-inflammatory diet, and this is the advice that I give with all the patients that I see in consultation at the Osher Center, and it's definitely consistent with the guidelines from the American Cancer Society. Now, I know aging is not just living life without cancer, but for an oncologist, healthy aging, that's how I would define it. And the American Cancer Society guidelines start out, the guidelines for nutrition and exercise actually start out by talking about weight. And if you haven't noticed, weight is a big problem in our country today. Largely, I think, due to increased utilization of corn as a sweetener. So the recommendation here is to maintain a healthy weight throughout life. If your weight has to fluctuate, it should be in an 11-pound range. That is, unless you're overweight, unless your body mass index is above 25, then you're safest to get down to where you're not above 25 and then maintain that healthy weight throughout your life. But avoid excessive weight gain and loss. And even before talking about nutrition, the American Cancer Society guidelines say adopt a physically active lifestyle and suggest that adults should have at least 30 minutes of moderate to vigorous activity on 5 or more days a week. 45 to 60 minutes is better. And I'll show you in a little bit how difficult that is for us to do. That is a big change. And recently I saw a CNN statistic that only 6% of Americans abide by that suggestion. Consume a healthy diet with an emphasis on plant sources. We should eat 5 to 9 servings of fruits and vegetables a day. And that's fruits and vegetables. If you're going to eat that many vegetables a day, you have to start in the morning. It's just an American sort of ism that we should eat eggs and bacon and toast or donuts and coffee and orange juice for breakfast. If you want to be healthy, you start when you wake up and start eating correctly. Whole grains, in preference to refined grains, should be used, and the consumption of processed and red meats in particular should be limited or avoided. With regards to alcohol for healthy aging and for decrease in cancer risk, men can have perhaps 2 drinks a day and women 1. Women at risk for breast cancer are safest having 1 alcoholic drink a week. Alcohol promotes estrogen. Estrogen for certainly breast cancer is something that often fuels the progression of the disease. So that's why it's not a sexist thing. It's a physiologic reason that women should have less. Now, these are not telling everybody to go out and drink alcohol. If you don't drink, that's even better, as we discussed with regards to cognition. For people, again, that don't have breast cancer, phytoestrogens seem to be very healthful, particularly men, aging men. Phytoestrogens from soy and flaxseed are good for the prostate. The beneficial effect of phytoestrogens on the breast is probably during development. Asian women in Asia have a much lower rate of breast cancer than women in the United States. And when Asian women move to the United States, their risk of breast cancer increases because they're eating a diet that is not as good as what they were having before. Cruciferous vegetables, those that grow in the shape of a cross, the flowers, broccoli, cauliflower, Brussels sprouts, cabbage, and kale, are very rich in indole-3 carbinol. This is a substance that's very chemopreventive, very antioxidant, and oncologists are actually looking at it as a possible intravenous chemotherapeutic agent because it's so potent. And that's why I eat broccoli 2 or 3 times a day, personally. It's also encapsulated now, indole-3 carbinol, but I believe it's best for us to get these nutrients through eating the whole food as opposed to taking things in capsules whenever possible. However, since not everybody is going to eat salmon, black cod, albacore tuna, herring, or mackerel each day, I think omega-3 fatty acid supplementation is necessary. But in the meantime, I do recommend that people eat foods, which I mentioned, those cold water fish that have omega-3. And the plant source of omega-3 would be flaxseed. Garlic, ginger, and turmeric are excellent spices. They lower cholesterol, they lower blood pressure, they also probably have some anti-cancer activity. Turmeric at the American Society of Clinical Oncology meeting last year was heavily promoted as a potential anti-cancer agent. Vitamin D3, the sunshine vitamin, also comes from these cold water fish. If you put dried mushrooms outside, they can also create vitamin D3, even though they don't appear to be alive to us. D3, however, is something those of us that live in San Francisco with the fog probably also need to supplement with a capsule. But we'll talk more about supplements in a while as well. Things to avoid, again, too much alcohol, trans fats, which are present in all those processed bakery goods and no longer in Kentucky Fried Chicken, but grilled or broiled meats may produce toxic heterocyclic amines, which in and of themselves may be causing cancer. So my standard recommendations to my patients and my friends are, again, as the American Cancer Society recommends, to increase plant-based foods, whole grains, fruits, particularly heavily pigmented fruits. We can't say enough about blueberries, and suddenly pomegranates are becoming very popular as well. And vegetables, particularly cruciferous vegetables, numerous times during the course of the day. Decrease animal fats. Now, I didn't mention my feeling about dairy, but I'm not a proponent of dairy. And I recommend that I think dairy is a major allergen and cause of inflammation in most of us. Many races, African, Asian, Jews, don't have the machinery to digest either the sugars or the proteins in dairy. And I think what it does is it sets up a chronic inflammatory response. It's associated with prostate cancer, ovarian cancer, lymphoma. I think there's a big lobby in this country to promote dairy. Again, Asians don't use a lot of dairy. They live long. Their bones are fine. There are other ways to get calcium. Poultry, Andy Weil, if you read his book, he believes that eggs and chicken and poultry are high in echinoic acid, which is a precursor to prostaglandins, which are inflammatory. You know, I think if we eat free-range poultry without hormones and antibiotics and pesticides, that we're probably okay despite that. And I feel badly telling people to eliminate dairy, refined sugar, and red meat. So I feel like if I'm going to get away with that, I have to allow people a little chicken every once in a while. I do believe that white foods, white milk, white sugar, white flour, white rice, except for basmati and jasmine, because those have a better glycemic index, are not good. We tend to eat heavily processed food in this country. It doesn't have nutritional value, causes a lot of insulin an insulin-like growth factor to be released. Those are pro-inflammatory, and they also increase cell division, particularly of malignant cells. So people must have heard by now of PET scans. That's the latest technology we're using to locate tumors in patients with cancer. A PET scan is basically we inject radio-labeled glucose or sugar into the body, and we count the areas where the radioactivity is most concentrated because the tumor loves sugar. So why feed cancer sugar? And we don't need sugar either, because with that increase when you eat refined sugar of insulin and insulin-like growth factor, you overshoot, your own blood sugar goes low, and you feel fatigued and a little depressed. And the only way to bring it back up again is to eat more sugar. So most people are on this up and down roller coaster all day long of energy and mood. And if you eliminate refined sugar, your mood and your energy levels stabilize. Again, I mentioned seasonings, and I drink green and red. Green tea is great antioxidant. The polyphenols have good chemoprevention. They prevent a lot of different cancers. And red wine is probably the reason that the French get away with eating their poor diet, which is against all the guidelines I've given, because red wine has resveratrol, which we think is a very potent antioxidant and may be something that's associated with longevity. With regards to milk, I put this up, and not everything comes from Harvard. We saw their research on penis size, but the School of Public Health dairy recommendations: should you get calcium from milk? When most people in the United States think of calcium, they immediately think of milk, but should this be so? Milk is actually one of many sources of calcium, and there are some important reasons why milk may not be the best source for everyone. These include, as I mentioned, lactose intolerant, high saturated fat, possible increased risk of prostate, possible increased risk of ovarian cancer. This comes from the Harvard School of Public Health website, which really I liked better the comments on milksucks.com, but I think this is a little less sort of conspiracy theory and paranoid than milk sucks. Now, there is some evidence that caloric restriction does promote longevity. In animals, if you restrict the caloric intake of animals very severely, they have lower insulin and increased sensitivity to insulin. Their core body temperature lowers. They have a delayed onset of age-associated diseases, and the age-related decline in functional tests is slower. So we don't want to restrict our calories to 1,500 calories a day, which would be sort of the comparable to promote longevity. So now scientists are looking for drugs that can mimic caloric restriction. And again, this is where resveratrol in red wine, and also, mind you, red grapes, may be having its effect in being a mimicker of caloric restriction. The second point, I know I spent a lot of time on point one, but I'm a big old Adele Davis, you are what you eat believer. And nutrition is really important. When you go into the supermarket now, there are so many things there that are not food. We need whole foods. And so I'll stop talking about food now. So Andy's second point is use dietary supplements wisely to support the body's defenses and natural healing power. This is a photograph taken by a high school friend of mine, Susan Eisenberg, who wrote a book called Don't Call Us, We'll Call You, about women construction workers, because she was an electrician foreman at building skyscrapers in Boston. And she wrote this book about experiences of a woman construction worker in the 70s and 80s. Now she has lupus and thyroid cancer. And so she's a poet now, writing slightly dark poetry. But she also is a photographer, and she finds this cemetery in Boston where she takes her pills and her supplements, and she sort of creates art. And this is a chess game, if you will, with her conventional medicines versus her supplements. And I think it makes a statement there. So with regards to aging, potentially useful supplements, and these are somewhat controversial. I still think a little vitamin C, maybe 200 to 500. I'm not a big high-dose vitamin C person because most of it you're just going to pee out. Similarly, I don't recommend any B vitamins because all they do is tint your urine that orange-yellow color because you're just peeing them out. You don't need them if you eat well. I mentioned vitamin D3, which is cholecalciferol, not ergocalciferol. I take 1,000 international units a day. It helps with absorption of calcium, and because I don't do dairy, you need to absorb calcium from other sources. And I take 400 international units of E a day, and that's E with mixed tocopherols, not just a particular tocopherol, because if you just take one, you may block absorption of the others, which are necessary. So vitamin E has been somewhat controversial. The medical literature likes to only publish the negative results of studies with vitamins because they're sort of a little anti-vitamin, not to sound too paranoid or conspiracy theory. But they published recently an article that vitamin E leads to increased mortality. And what they did, they took people who were on the verge of dying, and they gave them high doses of vitamin E, and they died. And then, so, I don't know. I mentioned omega-3 fatty acids from fish. I personally don't take fish oil because I find that a little unpleasant, but I take a capsule of omega-3. Don't get omega-3, 6, 9 because we don't want the 6 and 9. That's pro-inflammatory. We want the omega-3s. Also, as clean as possible without contaminants, of course. And I take it the second thing I put in my stomach in the morning after my mushroom extract, because if you eat and then take your omega-3s, you're going to have fish burps, and that's very unpleasant. But if you take your omega-3s and then eat on top of it, you won't get that unpleasant symptom, and you'll be more prone to take it every day. For people who have joint issues, I think there is good enough evidence that chondroitin sulfate and glucosamine may be useful. For men who have prostate hyperplasia symptoms, we did a study at the Osher Center showing that saw palmetto didn't work. And it was published in a major medical journal. But it was in men with moderate to severe BPH, benign prostatic hyperplasia. It's not recommended for that. It's recommended for people with mild BPH. So that's why it didn't work. So, I still think it's worth looking at. St. John's wort, which is useful for depression, needs to be carefully taken because of its potential to interact with prescription drugs. It's broken down in the liver by the same pathway which breaks down many prescription drugs, can cause an increase in the dose or a decrease in the level of the prescription drugs, leading to either ineffectiveness or toxicity. So very important always to tell your doctor if you're taking St. John's wort. Valerian is something for sleep. It relaxes. Melatonin also may be useful for sleep. For symptoms of menopause, again, Black Cohosh recently published a big article that it doesn't work. For some women, it does. So, everything that's evidence-based because it's a randomized placebo-controlled clinical trial doesn't necessarily mean that it might not work for one individual. CoQ10 is something that protects mitochondria. Anybody who has a family history of cardiovascular disease, any of my patients who get radiation around the heart, I think it's good to take CoQ10. Andy Weil suggests that anybody taking a statin, that statins can sometimes damage mitochondria, and that he claims that one of the drug companies actually has patented a combination statin CoQ10 because anybody taking statins should be on supplemental CoQ10. Ginkgo is the one that helps us remember things, but you have to take it 3 times a day, and I can never remember. So one of my favorite botanical combinations is Zyflamend. Remember Vioxx, that COX-2 inhibitor that got removed because people were having cardiac events? Well, Zyflamend is a 10-herb COX-2 inhibitor that has oregano, basil, ginger, turmeric, green tea, 10 different herbs. It's a slower onset of an effect, but I get, when I take Zyflamend, when I start to get something like what Ellen had with her knee, having pain, I would take Zyflamend. It might not be on the first day, but on the second day, not only is that better, but all these other aches and pains that I didn't realize I had are gone. It's a good agent, and I recommend Zyflamend. I mentioned mushrooms. I'm a big believer in medicinal mushrooms. Again, I like traditional Chinese medicine, and much of traditional Chinese medicine utilizes medicinal mushrooms. This is reishi, lingzhi, which is in Chinese medicine what's taken for immortality. This is shiitake, black mushrooms, which are also immune modulatory and perhaps have anti-tumor, antiviral activity. These are maitake, which are also potent mushrooms. This is hericium or lion's mane, which is good for nerve, for people who have neuropathic damage from diabetes or chemotherapy or HIV. I often suggest this. This is a website that I go to and refer my patients to get mushrooms for medicinal purposes. I think with regards to aging, some useful properties of medicinal mushrooms include antioxidant, immunomodulatory, antiviral, anti-inflammatory, anti-neoplastic, and also for women, some of these mushrooms may inhibit aromatase, which is what produces estrogen and is good for women with breast cancer that's estrogen receptor positive. Moving on to the third point, Andrew Weil says, use preventive medicine intelligently. Know the risks that you have for a specific age-related disease and get the appropriate diagnostic and screening tests and immunizations. Treat problems such as elevated blood pressure, elevated cholesterol in their early stages. And he means treat problems with conventional therapies as well as using complementary therapies, because what integrative medicine is, what we practice at the Osher Center, is a thoughtful and rational combination of conventional and complementary therapies, creating something that's really patient-centered and in a relationship-based medical practice. So just with regards to where we spend our money on drugs, the 5 costliest classes of drugs accounted for 2/3 of the $181 billion spent on outpatient treatment for adults in 2004. And the largest group were cardiovascular drugs, followed by hormones, which include estrogen replacement, central nervous system, which includes pain medicines, cholesterol-lowering drugs as a group were the 4th most expensive, and psychotherapeutics, which are antidepressants, antipsychotics, and sleep medications, were the 5th. In 2001, it was reported that in the 45 to 50-year-old group, about a quarter were taking blood pressure-lowering drugs, but by the next decade, almost half were. Drugs that were lowering cholesterol were also frequently used. And again, this was pre-911, antidepressants only in 15%, and Viagra only in 4% of men. But I don't know, 911 seems to maybe have changed our world. Hormone replacement therapy only present in 37% of women, and I suppose that would be decreased now from all that we know about those risks. Testosterone in men certainly got a lot of increased usage over the past decades. Testosterone used to be available as only a pill, which would damage the liver. It then became injectable. But subsequently, testosterone became available as first a patch and then a gel, and it became more widely used. And this whole disease or syndrome of andropause was basically invented, I believe, by the drug companies that were making testosterone replacement so that they could increase sales of testosterone as a potential fountain of youth hormone. So, I am concerned a little bit about the use of testosterone in older men, just like estrogen turned out not to be a good idea, hormone replacement therapy in women, because it could potentially fuel tumors. Now, in addition to the sex hormones, there's also growth hormone, which is promoted as a fountain of youth hormone, because secretion of this hormone falls off 12% per decade after we reach middle age. Now, I mentioned that estrogen has the abrupt and testosterone the gradual declines. A precursor to testosterone and estrogen is dehydroepiandrosterone and its sulfated form. and these also fall progressively after the age of 30, and by 60 are 50% lower than they were when we were younger. Now, recently, the New England Journal of Medicine did a placebo-controlled trial of DHEA, which is available over the counter at your drugstore as something for, fountain of youth. And they showed that neither DHEA nor low-dose testosterone replacement in elderly people has physiologically relevant beneficial effects. So it didn't do anything for bone density, for body fat, for actual hormones, for mood. It did, for some patients, there was an increase in quality of life, which is very subjective. But otherwise, there were really no benefits. I think a healthier way to stay young, as opposed to taking hormones, is to get regular physical activity, throughout life. Exercise, again, a recent Newsweek cover story suggested that exercise improves body composition in bone, keeping it mineralized, keeping muscles toned, and decreasing fat. It enhances the cholesterol profile, improves glucose and insulin sensitivity, reduces blood pressure, improves the tone of our autonomic nervous system, reduces inflammation, and improves cardiac function. So even modest improvements in fitness in people who previously were not fit at all are associated with large improvements in their health status. People who went from being unfit to being fit over a 5-year period had a 44% reduction in the relative risk of death from any cause compared to people who remain inactive. So this is important and overlooked. Proven primary prevention of cardiovascular disease, diabetes, osteoporosis, breast cancer, colon cancer, functional decline and falls among the elderly. A book that recently came out called Age-Defying Fitness describes 5 domains of fitness: posture, strength, balance, flexibility, and endurance. And you can see there the effects of aging in all of them. And we need to remain fit and active and work in all of these domains. So how fit are you? Are you standing as straight and tall as you once did? Is walking up a flight of stairs a strain at times? Are you getting up from a chair more slowly? Is it harder to look left and right when backing up? Now, who doesn't have that one, really? Do you get stiff with prolonged sitting? Is standing on one leg to put on a shoe difficult? Do you trip or lose balance more easily? Does walking or jogging a distance take longer? So think about your fitness. This is that survey, that, again, from Newsweek, where I was somewhat shocked when people were asked, which are the most difficult healthful behaviors for you to adopt? Giving up tobacco was rated by 21%. Now, I used to smoke, and I thought that was pretty difficult. Exercising enough, 48%. That was listed as the #1 thing. How many people in this room exercise to the level as recommended? Raise your hand. Well, so not so bad. Maybe it looked like 40%. So that's pretty good. Oh, don't, because these are my 2 dogs that both left me on January 4th of this year. But they were both put down on January 4th. But a new puppy is coming from their lineage on May 26th. So it'll be Dash and Lily this time instead of Byron and Shelley. So get adequate rest and sleep. And before I put this talk together, I had not yet read Healthy Night. No, is that the name of the book? It's in the book by Ruben Nyman that's in it's a wonderful, wonderful book. Oh, there it is. Healing Night. It's all about the healing benefits of sleep, dreams, and healthful awakening. Deep sleep, stage 3 and 4, characterized by the theta and delta slow wave activity, decrease with age. Men under 25 spend 20% of their total sleep time in deep sleep. By 35, only 5% is deep sleep, with a 75% decline in their human growth hormone, because growth hormone is put out during deep sleep. By 50, most men have lost the capacity to experience deep sleep and produce only negligible human growth hormone, but elevated cortisol, which is a bad hormone that damages our immune system. On average, interestingly, women get more deep sleep per night than men, 70 minutes compared to 40 minutes. Is this linked to the fact that women have a longer lifespan? And in his book, he also suggests this may be adaptive because of women and child raising and the fact that they need to be up more with child than husband, and so maybe that's why they ultimately get more deep sleep. There's a widespread belief today that sleep quantity and quality normally diminish with age, but it may be the other way around. That is, we prematurely age as a result of chronically poor sleep. Recent research suggests that the common signs of what we consider normal aging may in fact be symptoms of chronic sleep deprivation. So I thought that was really interesting. Sleep problems among the elderly are less related to age per se and more to lifestyle. And he, in this book, writes a description of Thomas Alva Edison that makes him sound like a speed freak. That this man, Thomas Edison, who invented the light bulb, was so driven and stressed and always wanted to be working and went through wives and divorces and everything. And he invented the light bulb so he can continue to work all the time. And Ruben Nyman says that much of the problem with our society today is we have too much LAN, light at night. And he suggests that what we need to do is return twilight to our lives. So now at home, at about this time, I start, because I have dimmer switches in every room, returning a little twilight and dimming the lights. And I don't walk into the bathroom right before I go to bed and have bright lights blaring at me, because he's right. You know, here I'm saying we should eat as close to nature and primitive man. We should also live in the cycle of the environment in which we exist. Long-term impact of overly driven lifestyle, use of excessive use of sleeping pills and substances, and also medications that interfere with our body's own production of melatonin, including aspirin and nonsteroidals, beta blockers and diuretics that every hypertensive takes, and benzodiazepines, Ativan, Valium, etc. So what are the integrative aspects of sleep? We should have a regular bedtime with no eating immediately prior to bed. I don't eat I don't go to lie down if I've eaten within 2 hours. I try to stay up. Avoiding alcohol right before bed. Limiting activity in the bedroom. You can figure out whatever you want from that. Appropriate lighting, as just mentioned. Evaluate medications that might be useful. And then for elderly people, brief naps may be useful. Melatonin, again, which our body produces in our pineal gland to let us know it's nighttime, is also available as a supplement. The dose people take, when I take a 3 milligram dose of melatonin, I get very depressed, weird dreams, and groggy the next day. So now I've learned to bite that 3 milligram tablet in quarters and just put a quarter of it under my tongue. So 0.75 milligrams under the tongue is probably a better way to go. And I do a lot of international, intercontinental traveling, and I do use melatonin to put my body into night when I arrive someplace for the first few nights that I'm there. Other botanicals that people might use for insomnia are listed here. The strongest evidence for valerian. Kava kava is felt to maybe be too hepatotoxic to the liver. St. John's wort I mentioned. German chamomile seems very benign, a wonderful thing to take, but that also may interfere with the enzyme system responsible for breaking down many of our normal prescription drugs. Hops, which is in beer. Lavender, not to take it as a pill, but lavender oil as an aromatherapy has been shown to be very calming. Passion flower is often combined with valerian, and lemon balm is also used to increase calmness. Point number 6, learn and practice methods of stress protection. Even better than reduction, isn't it? To protect ourselves from stress. With all that we know about how stress aggravates cardiovascular disease, promotes viral infections, exacerbates metabolic disease, halts reproduction, and regulates the normal function of virtually every cell in the body, why would cancer cells somehow be exempt? This is from the Journal of the National Cancer Institute Bulletin last month, when it was reported that stress does increase metastases in cancer cells. Does not cause cancer per se, but increases the spread. Because stress is basically increased epinephrine, which kills lymphocytes, the building block cells of the immune system, and it's increased cortisol, cortisone, steroid, corticosteroids, which are also immunosuppressant. So Newsweek 2001, how do you reduce stress? I couldn't believe watching TV, reading, and music are clumped together. When I gave this presentation in Africa, and one of my colleagues says, "Where is sex?" I said, "Oh, that's a good question." So I guess it's not there. But other ways that people reduce stress is by ignoring it, going shopping. 37% meditate, and 24% have a drink or a cigarette. So a little maladaptive, but there are other ways to reduce stress. Yoga, Tai Chi, mind-body interventions, many of which we offer at the Osher Center, hypnotherapy, biofeedback, meditation, imagery and visualization, breath work, spiritual healing and prayer, music and art therapy, and then if you want to do body-body, certainly massage therapy is a way to eliminate and relieve stress. Exercise your mind as well as your body, and things that one can do: learn a foreign language, learn how to use a computer, a DVD, or one of these fancy MP3 players, change the operating system of your computer. Yeah, that keeps your mind. That's what Andy recommended, that one. Read, do crossword puzzles. I don't know about Sudoku because I haven't figured out how to do that yet. Senior hostel programs are good ways to exercise your mind, and attending this institute. Maintain social and intellectual connections as you go through life. This is my little subgroup of my fellowship class. I will tell you that I went to, for the first time in my life, I did jury duty in 2002. And I came home and I said, I want to go to law school. And I got to look like, oh, really? And then I went to Telluride Mushroom Festival, and I heard Andrew Weil talking about his fellowship in integrative medicine. I said, that's what I want to do. And I realized that I wanted to be a student again, because I was at an age, above 50, where I just didn't know how long I was going to be able to retain new facts. And I always loved being a student. When I was in high school, college, medical school, it was fun. And I've been a teacher for so long, I just wanted to take tests and have homework. And I did it for 2 years, and I loved it. And it allowed me to also have new social connections. My classmates, I still am in touch. The one over my shoulder just sent me an email today. So, that's important. When you get to be a certain age, you forget that you can still, maintain new friendships. Point 9, be flexible in mind and body. Learn to adapt to losses, and let go of behaviors no longer appropriate for your age. And for this, I really turn to my dear friend Jerry Jampolsky and his wife Diane Cirincione. This is at their house in Hawaii, and this is my friend David, who is just a house guest this week, but this is from when we went to Hawaii last month. David's 60, Diane's slightly older, and Jerry is now over 80. And Jerry and Diane developed the Centers for Attitudinal Healing, which were originally designed for families of children with life-threatening illnesses. And Jerry wrote a book called Love is Letting Go of Fear. And we, in the AIDS program in the mid-'80s, required Jerry and Diane to come give us group therapy because we were suffering from a lot of grief that we didn't know how to name. And they taught us lessons each week. We had to write down a lesson. And these are lessons that I remembered. And actually, when I saw Jerry and Diane, I showed them this slide, and they said, you forgot one thing, and I added that. That's the third bullet. And they said, very good that you remembered for those 4 lessons. The most important, I think, is choose peace. And that is, you're late coming here, you're stuck in traffic, we'll still be here, so you miss 5 minutes. You can get yourself all riled up, you can get your adrenaline and epinephrine going, you can kill your lymphocytes, or you can just say, choose peace, and just choose peace. If you're involved in a tug of war with the nurse on the intensive care unit or whatever, or one of your students, if you let go of the rope, you're no longer involved. I mean, it doesn't mean be passive and, don't ever do anything. It just means you can escalate like that, or you can practice forgiveness, which is the one that I forgot. Not because I don't, but because I just didn't remember. When someone comes to you with anger, recognize it as underlying fear and return love. And that's very useful for me in encountering patients who want to blame somebody for their disease. They're frightened. So I don't return anger. You can do that, but then that's the tug of war. But if you return love, you totally disarm people. And then one that's really potent for me, fear of our own mortality underlies most of our fears. I know I get that from my parents because from my birth to my second birthday, 3 out of 4 of my grandparents died. My mother lost her mother and father. Can you imagine? From my birth to my second birthday? And so she vibrated, not enough that she's a typical Jewish mother, but she vibrated all of this fear of loss of people that we love, and fear of mortality into me, that I think is what got me interested in my field, which is first cancer, then HIV, and now cancer again, because just trying to get a grip on my personal, but recognizing that fear of our own mortality underlines most of our fears also allows us in a way to go back to number one and choose peace. Also, I think humor is something I believe in. Maybe you could tell. But there was recently a study that was published of a group that I don't often think of as so humorous, particularly, but Norwegians who were, maybe they are, followed for 7 years. I'm sorry, I don't mean to offend anybody. Please don't have the ambassador write me a letter. But participants filled out a survey on how easy they found humor and its importance. And the greater the role that humor played, the greater the chance of survival over the next 7 years. The people who were the most humorous in the top quarter were 35% more likely to be alive than the lowest quarter. And in the 2015 patients with a cancer diagnosis at baseline, a greater sense of humor reduced the chance of dying by 70%. They say humor works like a shock absorber in a car, allowing us to, without getting all addled. Coming to the end of our 12-point program, think about and try to discover for yourself the benefits of aging. And this PowerPoint demonstrates some things that we venerate that are old. Stradivariuses, red wine, cheeses, redwood trees. What about old people? Why do we put them away? Why do we hide them? In Okinawa, where Andrew Weil goes a lot, when they have celebrations and parades, the elder of the village or the neighborhood is paraded in front of everyone to start the whole thing because they're venerated. We need to get into that space where we appreciate age and we venerate it. There are benefits of aging. We get experience and wisdom. We have the gift of time to be creative and enjoy others' creativity, spend time with family, enjoy nature, freedom, senior discounts. The last movie I went to, The Queen, yes, right here at Kabuki. They gave me my first ever. I have it still in my pocket. It was one of those times, well, do you really want to do this or not, but for $2, really. But in July, I'm going to go to Hildy's birthday. Hildy's going to be 90 in Kansas City. This is her daughter and her daughter and her daughter. So that's 4 generations, and I think that's another benefit of aging, that you can see your family grow and you can experience the love and support of your family. Do not deny the reality of aging or put energy in trying to stop it. Use the experience of aging as a stimulus for spiritual awakening and growth. Too many of us in our society are trying to reverse the aging process by taking pills, by having facelifts, by doing tummy tucks, by trying to do anything to say that we're not aging. We are, and we need to appreciate aging as a fact of life and something that's very important and very beautiful. Andy ends his book by saying something that was very important. My father, who's now 83, was in an assisted living facility before he broke his hip recently, and he was writing still for their monthly newsletter. And I didn't think he could cope with the whole book, Healthy Aging. But the last chapter was about something that Andy calls the ethical will, which he says is based in Judaism. And basically, instead of just bequeathing the people that come after you material items, you should keep a little diary or a little manuscript which bequeaths to your successors what you learned in your life and how to best cope. It's called an ethical will. And there's a great example of his own in the last few pages of the book. And I really think that that's a great gift. I did ask my father why don't you write about this for the folks? But he didn't get a chance to. He's now in a different place with his wife, and he doesn't write for the newsletter anymore. So the bottom line of this, as summarized in that Newsweek article, all of this research holds a fairly obvious lesson. Life itself is lethal, and the things that make it sweet make it more lethal. Chances are that by starving and castrating ourselves, I didn't tell you about castration, but we can talk about it, we really could secure some extra years. But most of us would gladly trade a lonely decade of stubborn survival for a richer middle age. Our bodies are designed to last only so long, but with care and maintenance, they'll live out their warranties in style. So, thank you. I just want to invite all of you who haven't been, we have some brochures in the back and some brochures in the front, to the Osher Center, where we're celebrating our 10th anniversary this year. The clinic's only been in action for 5 years. We have massage therapists, traditional Chinese medicine practitioners, mind-body providers, family practice, integrative oncologists, physical therapists, personal trainers, many, many things that people can take advantage of. And I wish you all healthy aging.